Hello again. Could knowing your body composition be the secret to a faster, smoother recovery from hip surgery? That's exactly what I'll be discussing next week at the International Society for Technology and Arthroplasty meeting in Rome, or ISTA for short. In this video, I'm going to give you an exclusive preview of what I'm going to talk about. Last year, I did a video about using body composition analysis in my clinic. Well, next week, I'll be presenting some results at ISTA 2025. This is a highly regarded conference where surgeons, engineers and scientists share and discuss the latest developments in joint replacement science and surgery. As I said in my earlier video, I hate weighing myself, especially after a holiday. Eating and drinking too much often tip the scales in the wrong direction. At the gym I go to, they use body composition scales. These give you much more information than just your weight. At my last weigh-in, I'd found I'd increased my muscle mass and lost a few kilos. I've got to admit, it did feel good to see these numbers move in the right direction. I've been using body composition analysis in my clinic to help guide decision-making before hip surgery. And what we're finding is fascinating. Body composition scales work by sending an imperceptible electrical current through your feet. It's completely painless, and they measure things like body fat percentage, skeletal muscle mass, total body water, visceral fat, that's the dangerous fat around your organs, and even your metabolic age. These results are reviewed with a full clinical assessment done by me during your consultation. Together, they give us a much bigger picture of your overall health. So why does this matter if you're thinking about having hip surgery? Well, the more we understand about your underlying health, the better the decisions we can make about whether to operate, what type of surgery is best for you, and how to optimize your recovery. As an example, if your visceral fat is high, we can work together to reduce it, lowering the risk of complications like delayed wound healing and infection. If your muscle mass is low, we can help you build up strength through targeted exercises, even before surgery. This is what we call prehabilitation or prehab. Here's something else that's interesting. One of the metrics the scales gives us is your metabolic age. This is a biological estimation of how young or old your body really is. This is interesting, particularly for people who want to have hip resurfacing. Resurfacing surgery is usually done in younger patients, typically under the age of 55, and in men. But what if your metabolic age is younger than that? In borderline cases, this extra information might just help justify using a resurfacing, something that I'll be discussing at the ISTA meeting. To the best of my knowledge, we're one of the first orthopaedic clinics in the UK to use this kind of analysis to guide surgical decision-making and planning. The data we've gathered so far is really interesting, and it's obviously generating some interest in the international surgical community, which is why I'm going to Rome. The results show that particularly in women, muscle mass falls off after the age of 65. Men maintain much more muscle mass for longer. Fat mass increases in men and women as they go into their 60s. This is associated with an increase in visceral fat and falling health scores. Interestingly, health scores improve a bit in the 70s. I'll be showing how we're using this information to personalise care and improve outcomes, particularly in people preparing for hip surgery. If you're thinking about surgery, or you simply want to stay as active and mobile as you can as you get older, body composition analysis might be a game changer for you. It's non-invasive, quick and incredibly informative. If you're coming to see me in clinic, we can do this test as part of your assessment. And if you've had one done elsewhere, feel free to bring the results along. We can interpret them together. What do you think? Have you had body composition measured? Let me know in the comments. I'd love to hear your experiences. And if you have any questions about hip surgery, recovery or prehab, my contact details are in the description below. Thanks for watching and wish me luck for ISTA 2025. See you soon.